You've been diagnosed with gum disease. But what does that really mean? Let's break it down. I'm Dr. Louise O'Dowd, and being diagnosed with gum disease can be confusing, but the first step in managing it is understanding it. To understand gum disease, it's important to understand what gum health looks like. Here's a tooth which I've split in half. This is a diseased site and a healthy site. You can see here that the tooth is embedded in the jaw bone. Now the gum sits on top of the jawbone and it forms a little cuff around the edge. Now, if I put my instrument inside here in a healthy site, my instrument will stop when it gets to here, and the height difference between the top of the gum and the base of the pocket should be less than 4 millimeters. And these are measurements that your hygienist or your dentist may make. In a healthy site, there will be no bleeding. Now, if there is some bleeding, but not deep pocketing, we call that gingivitis, and that's normally reversible with relatively simple treatments. However, if the plaque and the bacteria that builds up around the neck of the tooth is left undisturbed, then that could proceed to periodontitis. And that's where you get a deepening of the gum pocket because this attachment has moved down and the bone also shrinks down over time. That results in the plaque and the bacteria finding its way down inside the pockets and forming hard barnacles or tartar. This is what we describe as periodontitis. So this is just a very brief overview of what gum disease is, and your own dentist or hygienist will give you more information following comprehensive examination. But remember, understanding gum disease is the first step in managing it. And now, you're one step ahead.